Cauda equina literally means horse's tail, and it is a collection of L1 to S5 peripheral nerves in the spinal canal. Cauda equina syndrome is defined by a constellation of symptoms that result from terminal spinal nerve compression in the lumbosacral region. It is considered one of the only true medical emergencies in orthopaedic surgery. Causes of Cauda equina occur when there is a space-occupying lesion in the lumbosacral canal, and this can come in many forms. One, and which is the most common, is disc herniation, and as you can see, this diagram shows there is a central prolapse compressing the spinal cord. The second is spinal stenosis, and this is a condition where your spinal canal begins to narrow. This narrowing can cause pressure on the spinal cord, as shown in this diagram. Other causes include tumours, trauma where fracture fragments can pinch or damage the spinal cord, and spinal epidural hematoma or abscesses can also put pressure on the spinal cord. Symptoms of Cauda equina can be unilateral or bilateral leg pain, and this is the most common presenting complaint. Saddle anesthesia can be caused, and this is where there is a loss of sensation to the buttocks, perineum and inner surfaces of the thigh, and as you can see here, S3, 4, 5 all innervate these areas. Impotence and neurogenic bladder dysfunction can occur. Bladder dysfunction occurs as the bladder receives innervation from the pelvic splanchnic nerves and also the hypogastric plexus. The external urethral sphincter is controlled by the pudendal nerve. In Cauda equina, bladder dysfunction will initially show as urinary retention, and this can eventually cause overflow incontinence. On physical examination, the findings may be as follows. On inspection, there may be lower extremity atrophy, muscle atrophy. On palpation, there may be lower back pain or tenderness, and also palpation of the bladder may show the urinary retention. Neurovascular examination should also be carried out, and this may show bilateral lower extremity weakness and loss of sensation. There may also be decreased or absent reflexes, and rectal or genital examination should also be carried out, and this may show decreased rectal tone or voluntary contraction. MRI is the imaging of choice for Cauda equina, and this can be used to evaluate the neurological compression. Treatment should be urgent surgical decompression within a 48-hour period, and this is shown to have better outcomes. The options are discectomy and laminectomy. First of all, discectomy involves the removal of the intervertebral disc to relieve pressure on the spinal cord. On the other hand, laminectomy is the partial or whole removal of the lamina of the arch of the vertebra. Thanks for watching, and I hope you found this useful.